For my PowerPoint presentation, I chose hereditary pancreatitis. The pancreas has many functions, which includes regulating insulin, releasing enzymes to aid in the digestion of food, and releasing bicarbonate to help calm stomach acid. When the pancreas becomes inflamed, that is called pancreatitis. With acute pancreatitis, the pain can come on gradual or sudden, with pain located in the upper abdomen that sometimes extends to the back. The pain may be mild at first and become worse after eating. The pain is often severe, constant, and commonly lasts for several days in the absence of treatment. Other symptoms could include nausea, vomiting, fever, and a swollen abdomen. The symptoms of chronic pancreatitis are upper abdominal pain. The pain may spread to the back, become worse with eating or drinking, and become constant and disabling. In some cases, the abdominal pain goes away as the condition worsens, but this is fairly uncommon. Other symptoms include the following: nausea, vomiting, weight loss, diarrhea, oily or fatty stools, and clay-colored stools. Hereditary pancreatitis is a rare genetic condition characterized by recurrent episodes of pancreatic attacks, which can progress to chronic pancreatitis. Onset of attacks typically occur within the first 2 decades of life, but can begin at any age. In the United States, it is estimated that at least 1,000 individuals are affected with hereditary pancreatitis. On average, acute pancreatitis occurs by age 10 and chronic pancreatitis by age 20. In my case, the genetic gene is on my father's side of the family. I was diagnosed with the PRSS1 gene and a CFT5 variant gene in 2000. I had my first pancreatic attack at age 8, and in 1982 little was known about hereditary pancreatitis. My great-grandmother and a great-uncle both died from pancreatic cancer. Although my parents informed the doctor that pancreatitis ran in the family, pancreatitis then, and in many ways today, holds a stigma that you must be an alcoholic. When people hear cystic fibrosis, they automatically think the lungs, but cystic fibrosis also attacks the mucous membranes in your body. The mucus that is produced becomes thick and sticky, which can block normal function of the organ. The lungs and the pancreas are the most affected by it. I was fortunate enough that it only attacked my pancreas. The cause of cystic fibrosis has been traced to mutations in a gene called the cystic fibrosis transmembrane conductance regulator, CFTR. The CFTR gene codes for a protein that goes to the surface of cells that line the pancreatic duct, airways, gastrointestinal tract, biliary tract, part of the male reproductive tract, and cells that are part of sweat glands. The CFTR protein forms a pore or channel that allows ions, including chloride and bicarbonate, to move from one side of the cell membrane to the other. The movement of these ions changes the concentration of molecules in the fluid within the ducts or organs that the cells are lining. The change in ion concentration causes fluid to move by osmosis. The result is pancreatic fluid secretion, moistening of the airway lining, a contribution to bile secretion, movement of digestive juices in the gastrointestinal tract, and sweating on the skin surface, among other actions. Loss or dysfunction of the CFTR interferes with this process, leading to organ damage or dysfunction. Some of the mutations in the CFTR gene cause partial or limited dysfunction. In these cases, the organ is weakened but not damaged. People carrying these mutations do fine until one of the organs that uses CFTR is stressed. Under stress, the organ may be injured or begin to fail because it does not have enough reserve to function. In the case of the pancreas, people with some mild CFTR mutations may develop acute pancreatitis or chronic pancreatitis without manifesting lung disease. With hereditary pancreatitis, there is no prevention. If you have the genetic gene, you have it. Some of my family members have had no issues with their pancreas, and other members, like my father and I, have had to have surgery. Other family members can eat what they want and drink alcohol. Some of them have one drink and they have a flare-up. With me, they felt that because I had the PRSS1 mutation, which was 75% dominant, and the cystic fibrosis gene mutation, which is 25% dominant, that is where my problems stem from. Having the two genes together are extremely rare and can cause extreme pancreatic pain. Treatments for hereditary pancreatitis may be prescribed pancreatic enzyme supplements to treat maldigestion, insulin to treat diabetes, analgesics and narcotics to control pain, and lifestyle changes to reduce the risk of pancreatic cancer. For example, stop smoking. Dietary recommendations to help control pain with digestion include the consumption of small meals throughout the day that are high in carbohydrates and low in protein and fat. Pancreatic enzymes such as creon, pancrease, and violase are helpful in providing improved digestion and reduction in diarrhea and pain for some patients with more advanced disease. There are also surgical procedures, such as the modified Pusteaux procedure, which can result in pain relief in up to 80% of the patients. Another surgical procedure, which can remove inflammation and masses on the head of the pancreas, is the classic Whipple procedure. However, this procedure does remove a lot of important tissue and can be associated with complications such as increased risk of death. When possible, modified Whipple procedures are performed to save more tissue compared to the classic Whipple procedure and can be successful for pain relief and return to daily activity. For appropriately selected patients whose pain remains incapacitating despite standard medical and surgical approaches, there is a total pancreectomy with islet autotransplantation, TPIAT. During a pancreectomy, a surgeon removes the patient's pancreas. This relieves the pain that the patient has been experiencing. Usually without a pancreas, the patient will develop diabetes. That's because islet cells in the pancreas make insulin, which control blood sugar. However, surgeons at the University of Minnesota Medical Center often perform an islet autotransplant along with the pancreectomy. During this process, technicians in the laboratory isolate islet cells from the pancreas that has been removed. The surgeon then puts these cells back into the patient's body where they can continue to produce insulin. This step can help prevent the patient from developing diabetes. Without treatment, the short-term consequences of hereditary pancreatitis are an acute pancreatic attack, and that can be deadly. The mortality rate of acute pancreatitis has remained at about 10%. Diagnosis of pancreatic problems is often difficult, and treatments are therefore delayed because the organ is relatively inaccessible. There are no easy ways to see the pancreas directly without surgery, and available imaging studies are often inadequate. The long-term consequences of hereditary pancreatitis are weight loss, even when their appetite and eating habits are normal. The weight loss occurs because the body does not secrete enough pancreatic enzymes to digest food, so nutrients are not absorbed normally, leading to malnutrition. They also will endure debilitating abdominal pain, frequent hospital stays, and their risk for pancreatic cancer goes up, in some cases as high as 40%. With me, my increase in pancreatic cancer was between 50 and 60%. And that is why I chose to have the TPIAT done at the University of Minnesota. I had reached a point in my life where I could no longer function. I was in constant pain and being admitted to the hospital about once a month for 2 to 3 days for pain control. School was put on the back burner, and it took all that I had to hold on to my job. I knew that if I did not do something drastic, I would end up on disability and likely die from pancreatic cancer. Dr. Beelman performed the 14-hour surgery and removed my pancreas, spleen, appendix, and half of my duodenum. My gallbladder was taken out in a previous surgery. Unfortunately, they were not able to harvest enough islet cells, and I am an insulin-dependent diabetic, but I can handle that. The moment I woke up after my surgery, that constant pain was gone. Since I was 8 years old, I always seemed to have a gnawing pain that progressively got worse over time. But that was gone. It wasn't there anymore. That was 10.5 years ago, and my life has improved 100%. I've been working and living a normal life, and now I'm able to go back to school and finish my nursing degree. It is a huge life-changing decision to have this surgery, and I would tell anyone who is considering it to look at all their options. Yet for me and hundreds of others like me, this surgery is our new beginning. I hope you enjoyed my PowerPoint presentation, and thanks for listening.